Hello, you're welcome back. Today we'll be talking about malaria in pregnancy. Why are we talking about malaria in pregnancy? So there's this woman that came to the facility where I once to work at 35 weeks gestation. When she came, she said she was having contraction. She's an experienced mother. She knew she was having contraction quite alright. So when we started doing the necessary things, we started by checking her vital signs and we discovered she was having fever. So because of that, we run some tests on her and we check for malaria. The results came out to be positive, so we started treatment on malaria. By the time she had the first and second dose of malaria treatment, the contraction stopped. So what happened if she had not come to the hospital early enough? She would have had preterm delivery, right? So this is one of the effects of malaria in pregnancy, and that is why we are talking about it now. So what are other effects that malaria can have in pregnancy? Number one, it can lead to anemia. Anemia is when there is reduced blood level, low blood level. So it can lead to fatigue, it leads to body weakness. It can also lead to low birth weight. It can lead to miscarriage in early pregnancy. You know, the pregnancy that has advanced is one that leads to preterm labor, right? But in early pregnancy, it leads to miscarriage. You see, the effect of malaria is not palatable, but it can be prevented, and that is why we are talking about it. So how do we prevent malaria in pregnancy? Number one thing is that to make use of mosquito treated net, and thank God most of our primary health centers gives mosquito net, but most women don't use it for that purpose. We are to sleep under this mosquito treated net that is being given, but we don't use it for that purpose. We use it for different purpose. No, we are to use it to protect ourselves against mosquito that can lead to malaria in pregnancy. Number two thing that we can do to prevent malaria in pregnancy is to make sure that our environment is clean. We are in the rainy season now and mosquito breathe faster. So because of that, we should cut the grasses in our surroundings, make sure that they are low. Then we should avoid stagnant water because this breeds mosquito faster. So when we can avoid that, we avoid the breeding of mosquito, right? And another thing that we can do to prevent malaria in pregnancy is to use mosquito repellent that are safe in pregnancy. We can also protect ourselves. You know, wear protective clothing as you are going out. You cannot be wearing mosquito net, right? As you are going out, but you can wear clothes that covers your body, that will protect your body from being bitten by these infected mosquitoes. So another thing that you can do that is very important is to take your IPT. You know, there's these drugs that they give us after our second from our second trimester. Fancy that they give you 3 tablets at once, but most of us we don't take these drugs, and that is why we take it as a direct observation therapy. You take it right in the health facility in the presence of the midwife, just to ensure that you take this medication. It is because of how important it is. That is where you take it in the facility in the presence of the midwife, because most of us when we collect these drugs, by the time we get them we don't take it. You feel like you don't like, some don't like taking drugs, some don't just like it and they won't take it, and I'm sure it's because you don't know the importance. That is why you're not taking it, and that is why I'm telling you today that that drug that they give you to take to prevent malaria, ensure that you take them so as to prevent the complications that I mentioned earlier. So another thing that you can do is to take all your prescribed medication, and if you are feeling any difference in your body, report to the health facility on time. Like that woman, what if she had delay, after all it's labour, let me stay a little bit, but she reported to the hospital and that was why it was detected early enough to be treated. So ensure that you take to the advice of your healthcare provider and make sure you attend your antenatal clinic visits. Thank you for staying tuned. See you next time.